Well, for ALL with CAR T cells, there are a lot of challenges. Of course, it's approved now in pediatric ALL, in second or greater relapse. I think in pediatrics, they'll likely be interested in seeing if it has a role earlier in therapy. In adults, of course, we don't have an approval yet. Is it simply a bridge to transplant? Can it be curative in adults? Who should we use it in? When this first came out, of course, there was great enthusiasm. We even talked about using it as initial therapy in older patients with ALL. Because we don't really do well in terms of curative therapies. But subsequently, of course, we recognize there's toxicities, who's more likely to get neurotoxicity, who's more likely to respond. So I think if we can better define those issues, then just as you're looking at a question of transplant and balancing risk versus benefit, I think you can do the same with CAR T cell therapy and decide whether it's appropriate for a patient and at what point in therapy one should consider this.